So excited to introduce you to Emily Givler today. Emily is a functional genomic nutrition consultant. Emily specializes in food sensitivities, and in her private practice, she uses dietary and nutritional protocols based on genetic predispositions and epigenetic influences to help her clients regain their health. Welcome, Emily.
Thank you so much for having me. It's great to be here today.
Oh, so excited. It's a lovely Tuesday morning together. I hope you have your coffee handy or tea or whatever you drink.
It's a coffee morning.
It's a coffee morning. Good. Um, just take us back where you started and then we'll go from there.
Sure. So as you mentioned, I'm a functional genomic nutrition consultant, which is not something you often hear about on career day at school. And I got into this field because of my own health challenges. I started having chronic pain and chronic fatigue when I was about 14 years old, and I was shuffled from doctor to doctor and in and out of physical therapy, and just kept getting progressively worse for the next 5 years. I was getting bone scans to see if there was cancer present, and nothing was coming up positive. And I just was feeling worse and worse more and more of the time. So the pain was increasing, the fatigue was increasing, and my frustration was increasing along with it. And I really got to the point where I wondered if maybe it was all in my head and everybody felt this way all the time, and I was just a big baby about it. But when I was 19, my rheumatologist finally diagnosed me with fibromyalgia. And it was such a relief to know that I wasn't just imagining it. But in that conversation, she also told me to plan on being disabled by the time I was 30. And that did not strike me as a really good plan. But because of the severity of my pain, the rapid progression, and how young I was when it started, this was what she saw my fate being. And she proceeded to prescribe me some narcotic painkillers. And she told me that my pain was just going to get progressively worse. And as it did, we would just take more and more drugs and deal with it in that way. And I looked at her and I said, well, I would like to have a liver and kidneys by the time I'm 40. And at that point, she prescribed me an antidepressant.
Oh my gosh.
I was relieved to know I wasn't just imagining how I felt, but I still didn't have any answers as to why. And so even the fibromyalgia label couldn't tell me why I felt this way. And I really believed that if I could understand the mechanism, then maybe there were other things that we could do about it. So I started my own journey to regain my own health. And there were many, many missteps on this journey. There were things that I did that I can look back and laugh at how much worse I made myself. Things that seem good on paper that work for other people. I went vegetarian for 17 years. And in hindsight, knowing what I now know, for me personally, it was not the right direction to go. But despite my missteps, I started getting better and better without taking any painkillers. And for me, that was personally important because it was just not, there was no end in sight. And I didn't like the idea of indefinite prescriptions. And again, that was just what was right for me in that time. So I'm happy to say that I will be 40 next week and I am not disabled. And I actually have about 3% of the pain that I had as a teenager. And even with having 3 young kids, I have about 10,000 times more energy than I had even in my 20s. So I'm really looking forward to my 40s.
Yes. Happy birthday early.
Oh, thank you. But it's been understanding things like functional genetics, appropriate detoxification, and finding the right personalized support for my body that have allowed me to get to this point. And so now within my clinical practice, that's what I help other people do, to find the right path for them, not as a replacement for a medical model, but often in conjunction with it, and finding this kind of happy balance between the traditional Western medical model and the nutritional kind of more alternative model of health.
And I love that. I think this is where we continue to go, and advocates out there, such as yourself, are helping to expedite it forward. And we appreciate you, because there's more. And I don't want to turn this into a total fibromyalgia episode. However, anybody who's listening who has fibro is going, hang on, backpedal, I need more information. So if we can rewind a little bit, can you keep going through that process where you kept getting that next moment of relief?
Sure. So now, if I were to do it today, my steps would be very different, and it probably wouldn't have taken me quite as long to feel good.
Take us through those steps.
I will. So stick with me. It's going to make more sense if we don't do it totally chronologically. So ultimately, the majority of my pain came from elevated levels of oxalic acid in the body. So oxalic acid binds with minerals like calcium, forms calcium oxalate, which is what causes about 60 to 80% of all kidney stones. Now, I've never had a kidney stone, but I've had that same insoluble, jagged, crystalline precipitate, which causes so much pain when it's in the kidneys and being filtered, aggregated throughout my body, primarily in the connective tissue and in the fascia surrounding the muscles. And it drives inflammation. These are jagged little crystals. When you look at them under a microscope, they look like little razor blades or like jagged shards of glass. And they are nanoparticle size. We're not going to see them on traditional like x-rays, things like that. So it's something that is difficult to image, and so it's missed. The medical community is great at figuring out that you have high oxalates if they are forming stones and you're peeing them out, and they can filter your urine and go, aha, I
Got
figured out why you have all this pain. But if that same insoluble crystalline precipitate is scattered throughout your body, driving this systemic pain, it kind of moves around but hangs out in certain areas, it's very easy to miss because we're not looking in the right places. So for me, oxalates were really the main driver. And oxalates come from a lot of different sources. One of the big sources is our foods, particularly plants. Plants like spinach, beets, chard, rhubarb are extremely high in oxalates. Certain nuts like almonds are quite high in oxalates. And I went vegetarian to try to feel better. Soy is also very high in oxalates. So all of these foods that we try to incorporate in a healthy vegetarian diet were pushing my pain level up and up and up. And my college had a vegetarian and vegan cafe on campus as part of our meal plan. So I had easy access to spinach and beets and chard 3 meals a day, 7 days a week, the whole time I was there. And my pain level just kept getting worse and worse. And I kept thinking, boy, this rheumatologist wasn't kidding when she told me I was going to be disabled by 40. And then when I was out of college and a poor post-college individual, without all of this access to all of this fresh produce all the time, I started having less pain. And I thought, boy, this is really paying off. And it turns out I was just eating less of the stuff that was wrong for me. Now, this doesn't mean that no one should eat beets or no one should eat spinach or no one should eat chard. If you don't have problems with oxalates, those are wonderful foods to include as part of a healthy, balanced diet. But if oxalates are driving dysfunction in your body, whether it is kidney stone formation, fibromyalgia, I mean, there are dozens of health conditions that have associations with hyperoxaluria or too many oxalates. If you suspect that might be the direction that you're going, then a very slow reduction of those foods may potentially be helpful. And if you do suspect that, you know, if you're someone with fibromyalgia and this is ringing true for you, don't just stop eating high oxalate foods, because that can cause the rapid release of any stored oxalates, and you may end up getting a kidney stone or exacerbating pain pretty significantly, and it can be dangerous. So if you're thinking that this sounds like maybe it's you. Slowly reduce oxalates from the diet, 5 to 10% per week. So slow taper off of them, making sure you're hydrating, making sure that you're putting lower oxalate options into the diet. If we're taking one thing away, we need to put something back in. So if you're currently eating like a cup or two of spinach every day, either in a smoothie or a big salad, swap that out for something like arugula, which is a lower oxalate option, but don't make it all or nothing. If you're eating 2 cups a day, cut it down to 1 3/4 cup and add a 1/4 cup of arugula. And then the next week, make it 1.5 cups of spinach, 1/2 cup of arugula. Make it this gradual transition. It'll be easier on your body and on your taste buds.
No, I love this. And for our listeners, anyone who's already going, oh, I'm already feeling overwhelmed. I don't even know how to find a food with an oxalate or how to slowly reduce it. This is why having somebody like yourself be a consultant and handhold you through the process. It can be gentle when we have that professional support on our side. It feels overwhelming if we are starting to just try to learn it all on our own, right?
And there are so many places where we can easily go in the wrong direction on our own. And that is a big part of my story. My pain level got much worse than it needed to be because I didn't know why. I didn't know why I was in pain, and I didn't know the appropriate steps to do about it. So we have a lot of tools at our disposal to figure out if this is an issue. There is functional testing that you can do. There's a wonderful test from Great Plains Lab called the urine organic acid test that has some excellent markers for hyperoxaluria. And it can actually help us determine not only whether oxalates are an issue for you, but if it's being driven by a genetic issue, if it's being driven by a gut issue, if it's gallbladder dysfunction causing it. I mean, the foods are only one of about 14 different mechanisms by which we can get hyperoxaluria. So even if we know that oxalates are the issue, nobody wants to, well, maybe not nobody, but I don't think that we should just stop eating all vegetables forever. I would not be the best nutritionist if that was my stance, but we should find the ways that we can maximize our diet. It shouldn't always be about restricting. Often there's a root cause for why we're having problems with these foods in the first place. For me, my gallbladder was a big part of the underlying reasons why I had oxalate issues. Genetics were part of why I had oxalate issues. Mold exposure was part of why I had oxalate issues. So it was these layers of things going on. And as I was able to address those root causes, I was able to normalize my diet without having the pain come back.
Who was your person that swooped in and all of a sudden brought some light on this where you're going, thank you, didn't even know that existed? How did that fall into your existence?
So I have a lot of people that I want to give credit to there. So in my journey, body work was part of it. And I started working for a chiropractor in Pennsylvania, Dr. Daniel West, and that improved a lot of the structural issues that were exacerbating my pain and probably resulting from the hyperoxaluria. So that was a big part of it. And working in chiropractic helped turn me on to the power of nutrition. So that was really a big part of my exposure. And then I had the very good fortune of going to work with Bob Miller, who's a traditional naturopath and just a visionary when it comes to functional genomics. He actually designed the software program that I use for genetic analysis. And we just grew up in the same hometown, and fate brought us together. And that was where all of these light bulbs started going off. So that was fairly recent in my journey. I was pretty far along this path, but understanding my particular genetics was where I really found those missing pieces and got so much clarity on why certain things had worked, why other things hadn't worked. I knew what had worked and what hadn't, but I still didn't have a full understanding as to why. And so Bob really helped me understand that with the functional genomic analysis software platform.
Interesting. Okay. So that would, for somebody again who is struggling with fibromyalgia, and let's say there's isn't about oxalates, this panel would start to help narrow down what are my areas that I need to be focusing on.
Yeah. So the functional genomic platform is the number one tool that I use to help my clients really hone in and figure out what their underlying predispositions are. So it's important that we remember that genetics doesn't tell the whole story. So sometimes we overstate the role that it plays. It's predictive information, and it's fantastic predictive information, but it's not the whole story. I always think about it as the framework of a puzzle. It's that outer edge. If we set that in place, it gets easier to contextualize everything else and to fill in the rest of the picture. Other stuff fills in the picture. Things like toxic exposures, dietary choices, trauma, all infection, all of those things influence the rest of the picture. But the genetics really sets the stage or lays that frame. So for me, oxalates were a big driver, but there's other stuff in my genetics that didn't allow the inflammation that the oxalates created to settle down appropriately. So there were certainly other places where I needed to fill in and compensate. It was within the genetics that I figured out that, it wasn't just the oxalate genes, but also genes relating to the gallbladder and bile acid synthesis. And that was kind of what was most upstream for me. So looking at the genetics can feel overwhelming to try to do on yourself. And people get really disheartened by a lot of genomic analysis where they're told, you have this gene, and it just seems like gloom and doom. Like MTHFR is a big one. I still have people walk in my door every day, walk in my virtual door these days and say, I have MTHFR, so I can't detox. That's just one tiny piece of a really big cycle and a really big genetic code. And maybe that isn't even giving you issues. So running that functional test with a practitioner who knows how to contextualize it for you and filling in the blanks with other functional lab testing, like I mentioned, the urine organic acid test from Great Plains, there's great synergy between those two. We can see the predispositions on the one side with the genetics, and we can see what's actually expressing and giving us problems on the other side with the functional labs. So when we put those pieces together, we get an explanation for why we're feeling the way we're feeling, and we get a path forward.
Right. So I have a question for you. I have a really good friend who ended up, coming all the way to Cleveland Clinic to really try to work with a specialty team. When you hear about that specialty team, are they investigating how you're investigating, or do you see that paired or meshed in hospital situations?
Well, I cannot speak for what the Cleveland Clinic is or is not doing. In my practice, I work with a lot of other practitioners, mentoring them on how to integrate these, what I see as important functional pieces into their practice, particularly genomics. So I do see more and more interest from the medical community in incorporating this data. There's a number of different ways of analysis platforms, of testing options. There's things like whole genome testing, which is sometimes done in that medical context. That is not what I do with functional genomic testing. Functional genomic testing is looking at SNP data or single nucleotide polymorphisms. And in my particular context, we're using it to determine things like food sensitivity predispositions or impaired detoxification, kind of looking at some of these systems and pathways to see where there may be kind of blocks that the average person doesn't have. So there's lots of other types of genetic testing that are incorporated in more that hospital model. So there's a lot of different avenues by which we can use genetics. So with the SNP data, those predispositions, they are really excellent tools for people who are dealing with things like autoimmune conditions and other chronic health concerns, or things like people struggling to detox from mold exposure or struggling with chronic Lyme. Often understanding the genomics can help us understand why other treatments that work for most people have failed for you, or the underlying reason for that chronicity or for that autoimmune condition, so that we can compensate appropriately. And more, the medical community is coming on board with this. So often, the big shock to everyone, the internet is so polarizing. We are made to feel like it has to be all or nothing, that we have to either go the natural route and do nothing but herbs and teas and essential oils, or we have to just take every prescription blindly. And there's really a lot of places where these two areas can come together. It doesn't have to be all or nothing. And we know enough now, like our knowledge has grown so exponentially, we can find those safe places to use them both together. And we can step outside of just the pharmaceutical model of take this for that and figure out the underlying driving causes of the dysfunction or lack of health and deal with them appropriately and regain our health and quality of life. So not every medical practice incorporates this, not every hospital or clinic setting does, but there are a growing number of particularly functional medicine minded practitioners out there who do really look at integrating all of these pieces.
Which is truly wonderful. I would just a follow-up question with that. Do you feel like your clients are telling you often, why has this not been looked at before? Like, I'm getting so much reprieve. Is there this, how am I just now learning about this type emotion?
I don't think so, because I think everyone kind of recognizes that this is all still pretty new. Like, why didn't I know this? Because nobody knew this. Like, this is the first time most of these people are looking at that. So by the time a lot of my clients find their way to me, I'm anywhere from their 6th to their 30th provider in some cases. And a lot of the time, the genetics hasn't been looked at, or hasn't been looked at in the way that we look at it with the functional genomic analysis software. That software, we're actively analyzing about 12,000 SNPs. There's, I think, 230,000 SNPs analyzed on the chip from the little tube you spit into. It's a huge amount of data to sift through. I think it's a really excellent resource, but it is certainly not something that is currently widely utilized. So I think people feel hopeful when they get this information. And I don't get a huge sense of frustration that it hasn't been found before, so much as excitement that it is finally found.
Yes. Oh, such a good, yeah, I agree. I just feel like, especially, and I'm sure, I don't know all of them, but fibro is the one that comes across my plate the most often, as far as seeking so many different types of therapy within it and getting minimal relief, but no hope for you to say that you're down to like a 3%, of the pain that you used to experience is mind blowing. It's amazing.
I love being able to say that, because I want people to find that hope and to know that you don't have to just give up or resign yourself to a life of indefinitely increasing pain. I've stumbled along the way, and I always want people to know that too, because if you're on the fibromyalgia road, you've probably hit those bumps, and it can feel really disheartening. So it's somewhat validating from my experience to help people avoid the pitfalls that I took. And, to sit here a week from 40 and say, you know what, I wouldn't change a minute of it. I wouldn't take any of that pain away, because it has educated and informed me so massively and allowed me to be the practitioner that I am today and to help a lot of other people. And
Right.
had I taken a different journey, had I just said, okay, give me all the painkillers, I mean, I probably would not be sitting here today.
Right. And without all of your research and your passion to be able to, you're just affecting so many lives. And yes, no one wishes pain upon anybody, but you're using it for good. And it's so amazing. You're going to help. My father-in-law always asks this question, and I feel like I'm trying to explain it, but you're going to do it way more beautifully. He's always like, I don't understand. Why does everybody have food sensitivities nowadays? Like when I was young, no one had a peanut allergy in my class. When I was young, I'm like, okay, I'm going to give the floor to you. You're going to explain it beautifully, and then we can.
How many hours do we have? So there are a lot of layers to this, and that in and of itself is part of the answer. So it's not just one reason. It's not that, oh, we're just more aware of it now by any stretch of the imagination. So the first place that we should look is in the gut at the microbiome. So our microbiome is our diverse collection of bacteria and protozoa and archaea and all of these other organisms in our GI tract, which numbers in the trillions. There's roughly 100 trillion organisms in the gut. It's just a mind-blowing number of species. And as someone who has been sitting here talking functional genomics, I should really admit that when it comes to genetics, we are much simpler than many other living organisms because we have effectively outsourced a lot of our critical biological functions to the microbes in our gut. There are certain functions that we need to live that we can't do. The bugs in our gut do them for us. And that has allowed us to do other things and evolve in different ways. But we are currently in a state where we've been obliterating those organisms in the gut. So things like serotonin production for not only happiness and well-being, but things like bowel transit and melatonin production for healthy sleep gets compromised significantly if we destroy the microbes in the gut because they are the ones that are making serotonin. So we inherit our microbiome from our mother when we're born. We're relatively sterile when we're in utero, and it's as we move through the birth canal during the birth process that we are inoculated. So babies who are born via C-section miss that initial point of inoculation. The second point of inoculation is when our mothers nurse us. So we get a lot of these microbes from breast milk. And so as we see rising C-section rates, as we see a decrease in nursing, not only now, but like our mom's generation and our grandmother's generation, there was a point where women were told, what do you mean breast milk is best? Use formula. Science has it all figured out. And so women were actively discouraged from breastfeeding because why would you do that when you could just feed your baby formula? So we have this generation of people who missed out on that inoculation of the gut and that immune system support that comes along with it. So that's part of it. Then as we bring in more and more antibiotics, they take out the pathogens, but many of them also significantly disrupt the microflora in the gut. Now we know that if we take antibiotics, we should take a probiotic afterwards to put some of those good organisms back. But for years, we didn't know this. I mean, I grew up, you got an earache, you took bubblegum flavored amoxicillin, and it was just given out like candy. And why wouldn't it be? We didn't know what we know now. So overuse of antibiotics without putting those good organisms back. I don't want it to sound like I don't think we should use antibiotics. There is absolutely a time and place. But if you're taking one that disrupts your microflora, once you finish that course, you should take a good quality, preferably clinician grade probiotic to compensate. So
I'm going to pause for a second just because in your line of work, I feel like we need to give this just little heads up, because I think people can get really sensitive really fast that like, I did have a cesarean. I did do bottom, there's these things where it's like, it's okay. We're all doing our own. And I know that this is where you're coming from too. And so when that happens, this is how, like, this is a perfect example. We can start to replace some of that and just be a little conscious. This might be an area we need to look at. It's not a, you did bad, shame on you, anything like that. It's just a, hey, heads up, this is an area to look. Sorry, go on.
No, that's okay. So it is really important that, we find ways to balance out, and we can't undo the past. That doesn't do us any good. Again, looking back at my own story, I see all of these missteps that I took when I didn't know any better. So once we know better, then we can do better. We can take steps to move us forward and with things like quality probiotics, and if it's right for us, things like fermented foods. We have a lot of tools that we can utilize to rebuild our microbiomes in meaningful ways. But we grew up not even knowing that it was there. Our doctors weren't taught that it was a part of us. It was just not something that we looked at. And so unbeknownst to all of us, we've been wiping out this microbial diversity. And along with it, it alters our immune system function and can open the door for things like food allergies. So all that long story to answer that, why are there so many more food allergies? This loss of diversity in the gut through multiple generations is a big part of it, because if your grandmother had a cesarean or didn't nurse your mom because it was the 50s and everybody was told use formula, your mom is disadvantaged. And then if she had a C-section with you because it was medically necessary, or if she couldn't nurse, then you're additionally disadvantaged. And so it builds from generation to generation. And the good news is that if we identify these things, we can start to course correct. And we have tools at our disposal to move ourselves forward and to make informed choices. I'm not a believer in guilt or shame for things that we could not have helped. I am a believer that with knowledge is power, and we can step forward into better health and more optimized wellness for ourselves, for our children, and for future generations.
Absolutely. For the individual who feels like, I feel like I have so much to change, where's your thought process, and how do you talk to that client to help? I get a lot of overwhelm, that feeling of, I'm already busy. My mind can't even go here right now, let alone like think about all that we're talking about. Where's the like lowest hanging fruit for you and your clients?
So baby steps are better than no steps. And you are not going to change everything in your life all at once. So get that idea out of your head and don't even try. Every step is going to help move you forward. We've got a ton of toxins and pollutants and things like that in our environment. We've got a lot of endocrine system disruptors. They're kind of coming at us left, right, and center. So I think there are so many low-hanging fruit. We don't even have to hit all of those at once. So water is a really big one. What water are you drinking? Are you filtering it? Or are you drinking it right out of the tap? So making sure that you are filtering your water appropriately is one of the biggest things that we can do for our health and wellness. And if you want to know what type of water filter is right for your water, the Environmental Working Group has a great free database that you can search by your zip code, and it'll tell you what's in your water and what type of filtration system will get rid of it. So it's the EWG Tap Water Database. You could just search for that and then plug in your zip code and you'll get all of that information. So that is one of the biggest things that any of us can do. We can decrease our use of plastic. Ideally, we want to get to the point where none of our food or beverage is touching plastic, but that doesn't have to happen overnight. So if you're someone who's still using plastic water bottles, whether it's a reusable one or a disposable one, spend $10 and gift yourself a metal or glass water bottle. our level of exposure to microplastics is horrifying. It is estimated that we ingest a credit card's worth of microplastics every single week. Every week. That's a huge amount of plastic in our water, in our salt, in our food. And plastics have a very negative effect on the liver and on the endocrine system. So they really mess with our hormones, our reproductive hormones, our thyroid hormones, our microbiome in the gut. So switching out what kind of water you're drinking and how you're drinking it are two big, easy steps that really can have a meaningful difference. So those are two of the most low-hanging fruit that we can approach. It's also worth looking at the common toxins in our environment, whether it's cleaning products, personal care products, the foods that we're eating and food additives. And there are a lot of good tools that we can use to make this fun and easy and less overwhelming. One of my favorite tools is an app from the Silent Springs Institute called Detox Me. And this is a free app, and it has kind of gamified detoxing your life. So if you don't know about your genetics and don't know which of your detox pathways are vulnerable, you don't know which one to maximize, that's okay. Put fewer toxins in, and then there are less to come out. So this is a step that whether you're dealing with fibromyalgia or food sensitivities or thyroid dysfunction or other autoimmune conditions, just cutting out these toxins is going to start to move the needle. It may be a slow nudge, but it's a tangible step that you can take. So this app allows you to pick which area of your life you want to focus on. Maybe it's your personal care products, maybe it's your food, and they'll walk you through action steps that you can take. And you can choose, is this something I want to do? Is this something I'm already doing? And every single one of those that you do is going to start to move the needle. Again, you don't have to do all of them at once. I have been on a journey to cut toxins out of my life for the past 20 years, and I'm still on that journey. There is still stuff that I can absolutely do better. And at some point I will, but I live in the real world too. And I know zero perfect people. It's not a standard we should hold ourselves to. It's never a standard I would hold my clients to. And I hope none of you will ever hold me to that standard either. So these little steps, cutting out, especially those endocrine system disruptors, things like plastic and the toxins that we get from our water here in the United States, are major things that have a cumulative effect over time that all of us can do.
Yeah. No, good. Thank you. It's just helpful to have even your resources that you're throwing out. Again, little things that somebody can grab today. It's just one small thing that you walk away and change. I'm already picturing, my kids do have plastic lunch containers. I love the different, like sorted out, almost bento box, but I know there's metal ones out there. So like that could be something easy just to switch out.
Yep. That we use little stacking metal bento boxes that fit really nicely in their lunch containers.
Yeah.
It's a swap I made a couple of years ago, and they last so long. My boys especially are hard on stuff.
Yes.
And plastic breaks much easier than these little metal containers. So
right, true. It's just making that initial and knowing it's an investment. Like, yes, it's a little more expensive, but it will last that much longer.
Yeah. So
yes.
We're on, I want to say maybe year 6 with the same lunch containers.
Wow.
So definitely worth that little bit of extra upfront cost for the duration in the long term too.
Right. Oh, that's good. I do want to talk about this. You have a Beyond Protocols and the 1,000 Practitioner Project. Can you tell our audience about this?
Sure. So in addition to my one-on-one work with clients, I also am the co-founder for a platform called Beyond Protocols. And we are a practitioner mentorship platform because I really believe so strongly in this work. And I think it can benefit so many people, and having guidance is really important. And there's just not enough people doing this work. So with Beyond Protocols, we're trying to change that. So we work with practitioners ranging from nutritionists and naturopaths and health coaches and acupuncturists to pharmacists and medical doctors and functional medicine practitioners. So really that kind of full gamut of healthcare on both sides of that healthcare aisle. What we do on the platform is we mentor practitioners on how to integrate things like functional genomics and functional lab testing to maximize client and patient outcomes. We want people to get better, faster, with fewer adverse reactions. And, it's not all take this supplement, it's not all take this drug, it's how can we go upstream to find what's causing this dysfunction? What are the pieces that we need to put in this puzzle for the picture to start making sense? So we've developed a method for working practitioners through this, helping them to understand. And we're really working on building a community of support because, even as I found in my own clinical practice, once you start dipping your toe into this world, there's not as many resources as we would like there to be. And when you're starting to learn the functional lab testing, or especially the genetics, it can feel overwhelming to know what's important, what's just there. As I mentioned, we're looking at like 12,000 SNPs. That's a lot of data points to try to make sense of.
Right.
So within Beyond Protocols, we work to help practitioners make sense of that data so that they can get their clients well in a more personalized way. When we develop these protocols, whether you're reading a book about, how to heal your gut or heal your thyroid, or if you're taking a prepackaged supplement kit for detox, those things are designed to work well for about 80% of people, might get about 50% well. And that's a pretty good target. But if you're in that other 20%, it doesn't really help you out. So what we do on the platform is work to help practitioners learn how to support that 20%, to develop truly personalized protocols for the people that they're working with.
Wow. Yes. I think the thing I keep hearing from some of the physicians, they order the labs, and this is what you're saying, and if they don't 100% know how to read them, there's a barrier there on wanting to order more labs, because if you can't do anything effectively with it, then it's a waste of time. So again, to know that there is a resource out there, a pairing out there that's going to handhold through, we've got these resources, we're here, that all of a sudden it builds that confidence on the other side of ordering more and looking into more than they might
Absolutely.
have.
And there are times that we find practitioners ordering expensive labs unnecessarily. It breaks my heart when people have come in and they've spent, $10,000 on functional lab testing, and their doctor didn't even know how to interpret those results, because very often when you're doing things like functional genomics, functional nutrition, even just functional medicine, insurance doesn't love it yet. So a lot of it is out of pocket. And so if we're going to ask people to invest the money in this testing, we better know what to do with it. It better be worth that investment for them. And again, there's so many people who need a good practitioner to help them navigate their health and navigate all of these pitfalls. My schedule gets booked out 4, 5, 6 months in advance. We need more practitioners doing this work because there is absolutely a huge and growing demand for it. So hopefully we can meet that need in Beyond Protocols.
Right. Well, and that's where my brain was going as you're talking. And I'm like, okay, it's great that you're virtual, but I'm guessing there's only one of you. You would have a resource list of who else to send people to if you can't get somebody in?
And within our practice, I am not a one-woman show. My colleague, Bob Miller, who is my mentor in functional genetics, is actively seeing clients at Tree of Life as well. My colleague, Jacqueline Downs, who's a fertility optimization specialist, is amazing for women on their reproductive journeys who really want to personalize their approach to health and wellness and the wellness of future children. And so we have a wonderful team put together. And then we do also have additional resources, particularly the other practitioners within Beyond Protocols. I can speak to their level of knowledge, and they are a sharp, sharp group of practitioners. So if we couldn't help you at Tree of Life, we certainly can help you find someone either local to you or virtual who can.
Fabulous. So the easiest ways to find you, or what are your preferred ways that people connect with you?
So at Tree of Life, our website is tolhealth.com. And if someone is interested in finding out more about what we do or scheduling an appointment, they can email clientcare@tolhealth.com. And if you're a practitioner who's interested in learning more about Beyond Protocols, our website is beyondprotocols.org.
Fabulous. And to all of our listeners, that will be going in the show notes if you are driving or doing something where you cannot be writing at the moment. Thank you so much for spending your time with us today. And let Direction Not Perfection wish you your first happy 40th birthday.
Oh, thank you so much. It was such a pleasure to be here with you today.
Oh my goodness, we got spoiled. Now we just need to kind of wrap our brain around all of this. And I love that there's a connect point for you. Any listeners who are out there going, holy cow, I feel like I'm lost and I just need somebody to take my hand right now. You are providing that support. So thank you so much for pouring so much love over everybody.
Oh, it is absolutely my pleasure.
Have a good week.